Hello, and thank you for inviting me to be your keynote speaker this year. I wish I could join you in person, but because of the pandemic, this is going to be a safer place. Welcome to my home. I am Maria Walls. I am an adult nurse practitioner in internal medicine in St. Louis, Missouri, and I am a registered nurse. I actually have 25 years of experience in healthcare. I was a candy striper is what they called it at the time, which now they call it volunteer, at St. Joseph Hospital in St. Charles at the age of 15. I worked as a gymnastics coach for a little while I was doing that, and then I became a unit secretary in a medical and surgical floor at Barnes Jewish Hospital downtown when I lived in O'Fallon, Missouri, which was a really big deal as an 18-year-old teenager, working the 3 to 11 shift, working all the way downtown, which was fun. Then I became a patient care tech back at St. Joseph and St. Charles, then a student nurse in the emergency department there. And then while I was at school at Truman, I was a certified nurse assistant at Kirksville Manor, which was the town's nursing home. I think it's probably got the same name. And then I became a registered nurse. I worked 6 years at Barnes Jewish Emergency Department, and then I worked for a little while in the PACU, which is the Post Anesthesia Care Unit, while I finished up grad school and could get clinicals in. So I've been a nurse practitioner since 2009. I'm going on 11 years as a nurse practitioner. And I am here to talk to you about, I want to say congratulations. Congratulations for finishing most of your didactic part of the nursing program. Truman State University is an amazing program, and I have so much respect, and I am so thankful and grateful that I attended the university and that specific nursing program. I feel like through the years I have been leaps and bounds ahead of my peers as far as my education and my experience there at that school. So you guys are really getting a great education, I promise you. One of the main things that I want to talk to you about today is integrity. And what does that mean? And how is that, how do we use that throughout our nursing careers? It's one of the core values that us nurses have, and you may not even realize that you have it. So I'd like to go through, I found an article when I was researching for this talk that went through different behaviors that people have who have a lot of integrity. And I think this is great to hear from a nurse and to kind of take with you through your journey here. The first behavior in this article is that taking responsibility for your actions. You are going to make mistakes. I have made some mistakes. Some of them were really big mistakes. And sometimes that is gut-wrenching and heartbreaking, and you feel like you're never going to get through it and you're never going to move forward, but you will. You just have to take responsibility for your actions. Number 2 is putting other people's needs above your own. So this is a good thing and a bad thing, right? So, but as a nurse, if I talk to you about patient encounters, and I give you an example of right now during this pandemic, I am starting almost all of my physicals and my Medicare visits and chronic disease management visits with, tell me how you're coping with everything going on in the world. Because people are not doing okay emotionally, many people. And as a nurse, putting your needs putting others' needs above your own, we are suffering from a lot of anxiety and fear of the unknown and all these personal feelings that we have. But when you're in a patient room, a person with integrity puts all of that aside and gives 100% to that person. That's an amazing attribute of a nurse. Sometimes it's not a good thing though, because then we're not dealing with the things that we need to be dealing with personally, and then that can be unhealthy. Number 3, offering to help others in need. I think this is obvious, and I think that all of you that are listening to this probably already do that, or you would not have gone to nursing school. Nurses are drawn to people who need help. And when people are in a time of distress or struggling or going through a difficult time, the first thing that we do, our first thing that our mind goes to is, how can I help? Even if we have a million things going on ourselves, even if we don't have the time or we're tired, we are the first people to step up and say, how can I help? Also a good, or sometimes not such a good thing for our own personal health. Giving others the benefit of the doubt. Through your nursing career, you are going to encounter people and patients that maybe have done terrible things. Maybe they're criminals, maybe they're drug addicts, maybe they're using drugs while they're pregnant. But we cannot judge people. We have to treat everyone as an equal. And we also have to be fair and hear other people's side of their story before we do judge. I see a lot of this going on in social media right now, where people are lashing out at other people, and you're not going to get anywhere by doing that or judging people. No matter what your feelings are about people, you have to treat everybody equally and hear their side of the story. So some of the people that post things recently about conspiracies and mistrust of science, instead of just me telling them that they're wrong, if I feel like that, really just saying, why do you feel that way? What makes you think like that? Really just trying to be open and getting people's story before you judge them. That's really important. We cannot be judging people as nurses. We're going to take care of people at the worst times of their lives and the best times of their lives. And we have to treat everyone equally, no matter what that person does or says, or what their views and values are. Choosing honesty in all things. Don't do the little white lies. Don't lie. Please be an honest person and don't get pulled into the drama. Sometimes, especially if you're a very introverted person, a follower, someone that maybe doesn't have a strong personality, you may be at risk for being pulled into drama and dishonesty. And please don't do that. Nurses are the #1 trusted field and career, and you want to make sure that people know that you're honest and that you're dependable. Show respect to everyone. I think we already talked about that a little bit, but you're going to encounter people that don't think the way that you do, or may say things to you that really gets to your heart, and you have to respect them, just like you would someone else. I just recently was in an exam room where someone told me that the COVID was a hoax and asked if I even knew anybody who had COVID. And at that time, I probably had about 25 personal patients that had it, and I had lost 3. But it was very quickly that I realized that no matter what I had said to this patient, I was not going to change his views. And I just moved on, and I treated him equally and with respect, and we completed the physical without talking about all of that stuff. Manifesting humility. So what is this? So you potentially are going to have a lot of great accomplishments, especially coming from Truman's program. You may be in leadership roles and have all of these wonderful things that you have done. Be proud of those accomplishments, but be humble. No one likes someone who's arrogant, okay? There's a big difference between confidence and arrogance. But be proud of your accomplishments, but don't brag about them all the time or feel like people have to tell you that you're great and you're wonderful. There's a lot to be said by being humble. Being able to admit when you're wrong. Sometimes you're going to be wrong and you're going to potentially say something or post something that's not true or disproven. And the best thing that you can do is admit that you were wrong and apologize. Apologies really are well respected and shows that you have integrity. Be reliable. Those with integrity are people that you can always count on. So if you're someone who cancels plans all the time or tells people that you'll do something and then you do not, that's not having integrity. You want to be reliable, and for people, your friends, your family, your patients, to know that they're going to be able to rely on you. Convey true kindness. I think this is pretty simple. I think that most nurses are like this. But above all, a person with integrity won't say something nice to your face and then say something else behind your back. So keep that in mind. Somebody who has integrity would be the same person in front of people than they would behind closed doors. So keep that in mind. Be kind, especially if you have feelings that, or someone else has feelings that, or thoughts that are against your moral and values. Just be kind and be nice. And all of this, integrity, is you want to do this because it's right. So you want to follow all these things, not because you think that it's expected of you or that you have to, but because it's the right thing to do. So thank you for your time. I'm very excited for you guys. Clinicals are going to be scary, and you're going to be nervous, and you're going to be uncomfortable. You're going to go through a lot of uncomfortable situations through clinicals and nursing boards and your nursing career. But we were all in that situation. I was there, and you will get through it, and you know a lot more than you think you know. So thank you for your time, and hopefully I will be able to meet you guys next year when you graduate, and have a wonderful senior year. Bye-bye.